quite impressed that there have been quite a lot of renovations that have been done. And these have taken precisely about 2 weeks. And there's more of these field hospitals that have been created. And so we will be visiting others later on, because we also need to demonstrate to the President and the government that the infrastructure preparation is actually on course. So I have been able to see here that there have been new additional beds that have been put in place, and I must say I'm very impressed with that. And secondly, when we were here, we discussed a number of other issues with the MEC and the Premier and the heads of department. So today we came to have a look at the progress. We've just finished a long meeting, which was attended by myself, the Premier, the MEC, and the very senior officials from different government departments. They've taken us through a briefing to look at how their provincial command council is operating. They've also taken us through various strands of their responses, beyond health, to look at how they're dealing with the approach to social relief, to dealing with issues of managing the economic activities, the resumption thereof. All of these issues have indicated to us that the provincial government is really on top of its game and trying its best to respond as expected. So we have also then been taken through some of the areas which we needed to attend to, particularly in the last discussion. We wanted to make sure that the issues of infrastructure are attended to, which today were demonstrated. Secondly, we raised the issue of getting additional human resources. Now, I've got a report from the MEC that they've employed over 800 nurses already within the past few weeks, and that they're also going to be finalize the numbers of additional doctors beyond what was done earlier this year, which is basically to prepare our response to deal with this particular pandemic. They have then raised various areas of concerns and constraints. I think at the top of this is the concern about the rapid spread of the infection in the Eastern Cape. We're all watching the numbers, and we think that that is a matter that we must give additional attention to. So in our discussion through with the Premier, it has been brought to our attention that there's the proximity to the Western Cape means that these two provinces are operating more or less like an ecosystem, where the numbers are actually showing a particular trend in increasing, going an upward trajectory. And so we are now embarking on additional programs to deal with containment measures. In the plans that they've showed us, we're quite comfortable that they are following everything in terms of the protocol of case management. And so the approach in various hospitals, the approach by the various clinical disciplines is actually all in line, and we are very comfortable again with that. Where I think that we are now really focusing on is strengthening on the containment on the community side. And here the major challenge are social activities, particularly funerals, where people come between Eastern Cape and Western Cape. They come to funerals. Some of the people would have passed in the Western Cape coming over for burials. And these are incidences which, when we track some of the contacts and some of the patients under investigation, we actually can locate them to have gone to some funerals. And so we still want to make a call to our people to be aware that funerals, because of the fact that they bring so many people together under very difficult situations, so they tend to have a contribution to the spread of the infection. Particularly, people tend to be closer to one another at that level, and we want to ensure that our people remember we want to have funerals should not have more than 50 people. And also, we have also said the memorial services at night before or night vigils should not be continued. We also want to say to our people that they need to be aware that exchanging utensils, exchanging shovels could pose a risk which we need to be alerted to. So those who are managing at the funerals, particularly those who are handling the soil and shovels and so on, we need to ensure that they use gloves and where possible use tractors or some equipment to move the soil so that we can reduce the risk of the infection at that level. The numbers have to be reduced quite dramatically because it's very difficult to keep the distance when we've got too many people. We have also emphasized the need for the wearing of masks, where everyone needs to wear masks, and we are saying our communities, people must use masks, and the cloth masks are acceptable, and those are the ones that we must use most of the time, because the specialized mask we want to keep for the health workers in the forefront. So these discussions we had, and we're looking at ways how we will need to integrate our health response to the ward committees of Maspatisane, where in communities, ward councillors, NGOs, churches, everyone works together. It's important now for people to know that the fight against COVID-19 is a community fight. It's about keeping the community safe. It's about protecting all members of community from getting infection. It's also about fighting the stigma that our people must not discriminate against anyone who's infected. It's important that people must not run away or hide the information when they are positive, so that they can be assisted. Even sometimes people have got, if they've tested positive, if they test positive, but they don't have symptoms, it still means they can still be taken for admission in a hospital. Not because they need to be treated, but because we need to keep them in a place where their body can fight the virus away from the community, which could easily get infected. So we want to call on our people to cooperate with our programs to contain the virus. In this case, we have also gone into all the detailed plans of the public or community screening and outreach program. That is on course. Again, we've even gone to refine that, because we believe we need to now reinforce what is being done in the area. So the areas which we are dealing with as hotspots, such as the one in Buffalo City or the other one in Nelson Mandela Bay, some of these districts we have actually identified areas where you've got high numbers. Where we've got such high numbers, they now need to be treated as hotspots with a team of health workers that must actually be stationed there on a continuous basis. And then when we get towards the end of the week, we're going to reinforce those teams with the Cuban specialists who will come in, because they understand the approach to community health, family health, where you actually need to look at not just one person, but you look at the people and the surrounding, and those who are in the immediate environment, in the surroundings, so that you can actually manage the disease as it afflicts the entire community. So we have confirmed that we will be making that kind of additional reinforcement to the team. But I was also happy to see that there's been quite a lot of improvement in terms of the plans, in terms of the reports, in terms of the structuring, and everybody has really been working hard. I could see that people have been spending a lot of time. Now, since I left from the 2 weeks I've been away, every day at 10 o'clock I would receive a report from the MEC. But of course, the reports are going all over, as has been happening. But now we made sure we get this report, so that between myself and the MEC, if there's anything of concern, we then discuss it. And so my visit here has also been as a result of that work. So I want to thank the MEC for the work that they've done, also the officials in the department. They've really shown a lot of movement forward. There was a team that was brought in here to reinforce them from National Department of Health. Some of them have actually gone back, but there are others, particularly the epidemiologists who are sitting here. They've taken us through, they've shown us there's a lot of progress, and there's a lot of enthusiasm amongst the team that are fighting this pandemic. So I really want to say that it's very, very encouraging. We also came to make preparations because the Commander-in-Chief, President Cyril Ramaphosa, is going to be visiting the province. So I wanted to make sure we understand if there are any issues there and also what preparations need to be done. And so we're also very happy to say that that is also on course. So I'll be briefing the President as well about how the situation has gone. So during the course of the week, towards the end of the week, President will be visiting, and the Premier and the provincial government have made all the preparations for that visit. And I think that is going to be a very, very good visit because to come in and give support and reinforce and guide and advise and lead, that's really what the President's visit will be about. President has visited a number of provinces, and wherever we've been, you find that it actually helps to uplift the spirit of everyone in the province. It also creates a lot of enthusiasm. It creates a lot of courage to move on in the fight. And we want to say to everyone that we need to continue to work together at this level. In particular, I also want again to pay tribute to our health workers who have always been in the forefront in the fight against COVID-19. And in this case, there's been a lot of discussion about the availability of PPEs, the protective gear. And again, I got a thorough briefing in terms of how much has been done. So I must say that out of the reports that we've got, we've insisted that we must get continuous updates so that no worker can be exposed to treating patients who might be potentially infectious without having a proper PPE. We have also indicated that we're going to continue to support the provincial government to order additional stocks of PPEs so that all those who have been very uncomfortable, that have not been aware of how the PPEs are available in every institution, they need to be assured that there is attention that's being given to this issue. So again, on this one, we're watching it very closely, and we're going to be getting very frequent reports so that the protection of our staff is also prioritized. Having said so, I'd like to just indicate, thank you. I'd like to just indicate that we have continued with the public screening program, and at this point we have had almost literally all the provinces. They were reporting to us last night. We had our meeting with the National Health Council, all the MECs till very late last night, and it's very clear that everyone is very enthusiastic about it. And in this province, they've almost done 1 million people who have been screened, and in the rest of the country, we just around 8 million people that have been screened. And out of those, we've actually already done 356,067 tests, and that's a very large number of tests that have been done. And if any of you have been following, you will have noticed that when way back in the early days of February, March, we're doing about 400 or so tests. The numbers increased to a couple of thousands and so on. Now we are actually going to the highest possible number of tests that have been done. So out of the 356,067 tests, 14,000 were new tests that were done after yesterday's report. Now that's a very high number. When we said we're going to be increasing our capacity, that in fact has been done. So the bulk of these are being done in the public sector. 56% are done in the public sector, and the others are still being done in the private sector. There have been additional new cases that have been identified, 637 of them, and therefore making our total to go up to 10,652. Out of these, Eastern Cape accounts for 1,356. The Free State remains at 135, and I think you should be aware that there's been no patient identified. And this is interesting for the Free State because there was a time when they were actually amongst the ones that had a rapid number of people increasing in the Free State. Then Gauteng, we've got 1,971 with new 19 additional cases reported. And then KwaZulu-Natal, 1,372. And then in Limpopo, they remain at 54. That means there were no new patient reported. Mpumalanga, only 2, so they've got 63. Northwest, they've got 50. That is 5 more. Northern Cape, 1. That makes the total up to 30. Then Western Cape is the one that's got the highest increase, 453. So it gives us 5,621 from one province. Now that is a matter of concern because it puts at Western Cape at 52.8% of the total numbers in the country. We have certainly got to report additional deaths. So at this point, we are certain to report 12 new deaths, 8 from the Western Cape, Eastern Cape 2, KwaZulu-Natal 1, and Northwest 1, and this is the first one in the Northwest. And in the Northwest, this one is a patient who had comorbidities, largely what we call a thromboembolic phenomenon. So he came in with what is thought to be myocardial infarction, hypertension, and diabetes, and then they found that he had a number of clots in the blood system, and so we lost that one. We want to express our deepest condolences to the families and relatives of those whom we have lost. I also want to take the opportunity to thank and appreciate all our staff, particularly all the health workers, for the hard work that they've put looking after these patients. In fact, at this point, we record 4,357 recoveries, people who are no longer part of causing the spread of infection. So this means there's been quite a lot of work. So those total deaths and those recoveries is what we call closed cases. So their numbers remain in the total number of people who have ever contracted coronavirus, but we know that they are no longer infective. And so we keep the numbers because we have to keep the tally of how many from the first patient we have, but not all of them continue to be active cases. So we make a distinction between active patients or active cases. Those are the ones who still have potential of infecting others. And then there are those who would call resolved cases. Resolved cases means they would have either demised or they would have recovered, but they are no longer in the health management system, in the case management system, so they are outside. And so we therefore, at this point, want to convey our appreciation to the rest of the staff, and particularly the nurses. Tomorrow we're celebrating International Nurses Day. I want to say best wishes to all the nurses, everything of the best. I'm sure Florence Nightingale, wherever she is, she will really be very proud of the work that you're doing. We will nevertheless have a proper symbolic appreciation, as kind of ceremony of appreciation to the nurses, which will have to be done tomorrow. At that point, therefore, I want to say thank you to members of the media once again for keeping this matter alive and for being out there to inform our people and engaging. And I really think that the work that you have done has assisted us to deal with all sorts of fake news. And I've found this to be a lot more encouraging when you see how the media is really focused on the key issues. When there are questions, you raise them, we deal with them, and you can at least focus, because there's only one way of dealing with this issue, is to really follow the scientific principles of how this kind of problems of diseases gets managed. And so if the media is able to put forth those views so that we can separate between concerns of people as well as the principles, the scientific principles of clinical management of a viral infection and outbreak, and therefore it makes it easier for the communities to follow, because people must be well informed and people must always be able to make their own judgment in terms of what's happening. And so far, South African people have really been wonderful. There have been instances here and there where we've actually raised concerns, and I think the media has reported, but by and large, people in the country have actually been very supportive. It's a new condition, takes a while to change behavior, so the fact that people have been giving the kind of attention, we really do appreciate that. So with all of that, I want to say thank you, and leave it at that. I'm sure MEC might want to also say a few things, seeing that we had visited her province. MEC, if you'd like to make a comment. Okay.
I think let me first endorse the plea that has been made by, in particular, people with disabilities who, because we are not having interpretation services, have requested that we actually remove masks when we speak so that they can read our lips. So I know we have been so much accused to say we're not wanting to wear masks. It is only because we're accommodating everybody. For that, first, let me greet you all. And as I do that, I want to first appreciate the assistance that is ever shown by the National Department in the way Dr. Mkhize is taking us into confidence in ensuring that as we all are in a learning curve of something that has never happened, we're also actually assisted in how we can do things better. And I would want to appreciate the tenacity of ensuring that all provinces, as and when they need assistance, he is always available. The other issue, Kabazela, that I thought would be impressive in terms of what we're doing today is to actually announce that Cecilia Makiwane is only the first wing of the renovations that is open today. We've got another side. Those who know Cecilia Makiwane and the upgrades will know that there's an old side, which is the casualty, the old casualty. If you can get there, you'll see that that area is busy under renovations, and sooner we will find our own ICU in that area. And for that, we had Kabazela to actually see to it that we open the site, because we've got our PUIs in F2. And immediately we've got PUIs. The next challenge is to ensure that we've got space for those people. So right now, we are not worried if we can have some people who need some quarantining, and one part, as you have seen it, it fits that, and the other side fits isolation. And immediately, we shall now be a bit comfortable. What I want to appreciate is the readiness of the nurses that we've actually seen here, the doctors that we've actually seen here, when everybody else has got anxiety to nurse COVID-19. I want to appreciate the willingness of the staff, and sometimes we want to appreciate more when they are wearing their white, as we see them today, because to us, they still symbolizes that purity of nurses, where you have hope that when you are treated by such beautiful people, that indeed you may be okay. As we leave Kabazela, I want to actually thank the media, and of course, without you, we are nothing. Whether you criticize us, we always get something from the criticism and build ourselves. Thank you.
Thank you. Yeah.
Thank you, Honorable Minister, and thank you, Honorable MEC. Colleagues, we're only going to allow you 3 set of questions. Yanga, JJ, and you. Yanga?
There has been reports that some of the Cuban doctors who came into the country might have tested positive for COVID-19. Can you confirm this?
JJ?
Yeah, my Minister would be, what is the impact of the Western Cape, Eastern Cape travel, considering that 58 people that were tested as they were entering the province are back in the Western Cape now?
Third question?
Did we as a province underestimate COVID-19? Because at the beginning of the outbreak, there was only Livingston Hospital that was identified as a facility to accommodate the patients.
Over to you, Honorable.
Thank you. Let me start with the last question. I do not want to believe that there has been any underestimation of COVID in any way. However, COVID is a new phenomenon and it is a disaster. Naturally, if we understand disasters, we will be able to understand that you are facing something you don't know, how it's going to actually change itself. When we started to look at facilities, in Nelson Mandela, so to speak, as you speak about Livingstone, Livingstone was never an area alone in terms of the areas that we'll be looking at. Doranginza was also one. Hence, there's already been movement into Doranginza to take a particular wing and immediately upgrade its facilities, in particular ablutions, so that it fits. As we speak, we do have patients in Doranginza, as we have patients in Livingstone. And subsequently, because when you actually in a tip of an iceberg of something you do not know, you will have to gradually move with it as it also moves. So in a sense, the whole issue of COVID-19 has not been a static movement, it has been a dynamic movement, and also we had to actually follow it as it is dynamic. So my view, it's not only in Port Elizabeth, it is all areas. When we came to this area, we also were looking at this institution, which is Cecilia Makiwan. This is not the area that we initially identified. It is only after touring this facility that we saw this wing. Guess what? It's the first to be ready, more than the ones that we identified. So it is not a matter of not planning properly, but it is a matter where everybody moves with the swing, and the wave, of course, is coming faster, so we also have to actually move faster.
Thank you very much. The Cuban doctors were put under quarantine in Cuba for about 19 days before they came over. And all of us must also be aware that Cuba has far less COVID-19 than our own country. We took the precaution to take them through, and they will be released in the next couple of days. They are under the care of the South African Military Health Services, but we are not aware that they've tested positive. As far as we're aware, they will be tested, and then we'll have a sense as to what would have happened. But at this point, we don't have that report. The reality also is that the Cuban doctors came here out of the love for humanity. They came here because they've been sent into more than 26 countries all over the world to go and assist in tragedies, in disasters. They are always amongst the first ones to volunteer. In Cuba, it's an honor to go and volunteer and save lives in a place, even if it looks very dangerous. And it's a kind of spirit that I think, a spirit of serving that we really need to emulate and thank them for. And when Cubans have come all the way, when they've got less COVID-19 problem in their own country, I would have expected that South Africans would have been cheering to say thank you for coming to assist us, thank you for coming to reinforce us. I don't think it is correct to have all these snipes and jibes and negative sentiments, because it just really is an unnecessary kind of stereotype. Well, as far as we're concerned, Cuba has got one of the best health services in the world. And from that point of view, we really feel that the partnership that was started by President Nelson Mandela and President Fidel Castro has served both our countries well. It should be remembered that South Africa started having this agreement many years ago. The whole team of professors and heads of deans of medical schools went to Cuba to go and evaluate their curriculum. They came back and with a recommendation that they were happy with the training, and in a number of areas they were more advanced, particularly in the area of community health, because they have a level of provision of doctors where you've got one doctor for every 250 people, which is not heard of anywhere in the world. And so it was therefore agreed that there will be an arrangement to bring in the Cuban trained students to come and spend their last year in South Africa, so as to familiarize themselves with the new with the disease conditions that are in South Africa, and also to begin to convert to the language so that most of their training is in Spanish, so that they must be able to familiarize themselves. This year we're going to be graduating close to 700, the largest number ever to be trained in any 1 year by one kind of program. And so we welcome the Cubans wholeheartedly, and we actually know they will be adding lots of value, because one of the issues why I came here, for example, was to start to prepare the kind of plan in terms of strengthening primary health care and community health services that will be reinforced by the presence of the Cuban doctors. Hopefully one of the benefits for South Africa will that be after COVID-19 outbreak, we will be able to have restructured our health services, that in future when we get these kinds of problems of outbreaks, which are community events, we can actually respond better than the kind of crisis that we have now. I was discussing, for example, with the top specialists in Cape Town, Western Cape, a few days ago, and my observation to them was I was very impressed with the solid plans that they've got. All the professors who presented, and the case management, and the approach to investigations, the approach to treatment and everything, except that our system is very weak when it came to the community health side, the primary health care side. It's a weakness throughout the country. So some of the good work, some of the trained specialists do is overwhelmed by the fact that we haven't got a balance with the community health side. And so we need people with the kind of expertise that the Cuban specialists are going to bring, where they're going to help us to stabilize the infection long before people end up in hospital, because this is how you need to balance this. You must treat those who are in hospital and make sure that they get better, but make sure you prevent, screen and test, and prevent as many as possible from getting a very severe infection. That's the balance we are going to have. And I hope that in future when we talk about Cubans, we'll look at the good work that they will be able to do, the positive contribution that they will make, and not always look for all sorts of negative things to say about Cuba, because as far as we're concerned, it's one country that really has gone all out to help people without much expected, just to say they would love to be adding where we're saving humanity. So from that point of view, we're really quite happy that the Cuban doctors are here. They will be coming to the Eastern Cape. We've already said they must finalize the structure so that they can be deployed directly. I was in the Western Cape. They will be coming to the Western Cape. These two areas are going to need additional expertise, particularly at the community health side, at the primary health care level. That's really where I think we need more reinforcement. And so with that balance, I think we really are going to be ready to face up to this pandemic. And so, yes, from where we sit, I think that the Cuban doctors are really very value add into our system. The issue of the relationship between the Western Cape and the Eastern Cape, literally, this is a point that we've actually been discussing. The people who are in the Western Cape and the Eastern Cape are the same community. And the movement between there is not even an incident. We were talking about this and laughing, because somebody can actually wake up from Libode and then go to Cape Town, and then the following day he's back, and it's like he's just gone to town and came back. That's the nature of the connection between all our people. And therefore, when there's one area which is affected by the outbreak, certainly the one nearby is going to be affected. And I think, as I've said earlier, these two provinces are going to be affected to a similar extent. So it's important for us to look at them and assist them and work with them in a way that we understand that the dynamism of the movement of our people is a factor that will have an impact into the spread of the infection. And so we have to work together. So when I was discussing with the Premier of Western Cape, I had raised certain concerns that had come from the government in the Eastern Cape, and I was quite pleased, and this was now confirmed by Premier Mabuyan, that the two premiers and the two provincial government have already been in touch discussing how to manage the spillover of the infection that's affecting these two areas, and particularly as it relates to the large movement of people, the trade routes, and the seasonal workers, and all of that. Is something that we have to take into account as we manage the containment of the infection. So we can just say that we are watching. We are actually trying to do everything to make sure that we contain the spread of the infection in both provinces. That's precisely why you would hear the President is visiting Eastern Cape, and then the following day is going to visit the Western Cape. That's because the proximity is actually affecting the people. But if you know the pattern of the movement of the people in South Africa, you would know if there's a problem in this province, it's certainly going to affect those other provinces, because we know the pattern of movement, and therefore, from that point of view, there's nothing really that surprises us. We must just make sure we prepare ourselves better to be able to contain the further spread. Thank you very much.
Lastly, Minister, how many of these student doctors will be sent to the hotspots in the Eastern Cape? And also, how are you going to...
The last one was the last one.
How are you planning to address the issue of the language barrier? As you have mentioned, these doctors are trained in Spanish, but I don't think people in motherland speak Spanish.
Have you been to the hospital to say how many doctors don't speak this Xhosa? Have you been to the hospital to say how many doctors don't speak Sesotho? Or speak Shivenda or Tonga? So there are many South Africans who can't speak the languages. And we don't raise this question. We raise it because it's Cubans. Now, there are many South African doctors now who speak Spanish, who are trained in Cuba. There are many students from South Africa who speak Spanish, who are trained in Cuba, who are here to qualify, quite competent, ready to qualify as doctors. So I don't believe that you'll have a problem as such, but I would have loved to ask you, if you ask the question, how many of our doctors are having a problem because they can't speak isiZulu, isiXhosa, isiSotho, because that would make a bit more sense. I think that's really where we should be focusing as South Africans. Rather than going to go all out, we actually need to remove a real big log on our own eyes before we point a finger at people who are from other countries.
Colleagues, let's close it. I will be available to take follow-up questions, and the MEC will be available to deal with those later. Thank you very much.